Okay, good afternoon, everyone, and welcome. If you're just joining us, drop a hello in the comments right now. Tell me your, tell me where you're watching from, because I love seeing all your cities coming. My name is Loretta Ngwebe Sibiel, and I am the host of this channel and proud to be part of the Do Take Action family, where every Thursday at 3 p.m. we show up and have honest, important conversations about health, real health, the kind that affects um, real people, you know, the kind that affects real people and communities. So now today we're talking about something that I think is one of the most overlooked conversations in health, in health health in education, not just a health class on the timetable. I mean, the actual health conditions inside our schools, what children are breathing, drinking, what they are eating, feeling, and what teachers are carrying, and how all of that shapes whether learning can even happen in the first place. So, I want to ask you something before we go any further. Think back to your own school days. Honestly, did your school have clean working toilets? Did they have clean water you could actually drink? Did you ever go to school hungry, and try to sit through a lesson? Did you ever have a teacher who was so tired and stretched that the whole classroom felt heavy? Did you ever feel in your school that your well-being did not really matter, as long as you passed your exams? So if any of that is is resonating right now, this session is just for you. And if you were fortunate enough to have a school that took care of you, this section is still for you. Because somewhere very close to where you're sitting, there is a child in a classroom that looks nothing like yours did. And that gap is not okay. A child who is hungry cannot play. A child who has no clean toilet, especially a teenage girl going through a period, may stop coming to school altogether. A teacher who is burnt out and unseen has nothing left to give. So health and education are not two separate conversations. They have the same conversations, and today we are finally having it together. I have two incredible guests with me. Firstly, I have Mr. Favored Caleb Chukwuemeka Elue. He's a dedicated healthcare manager and skilled diction instructor, known for a strong sense of determination and personal drive, with a passion for both effective healthcare delivery and clear, confident communication. Mr. Favored Caleb has built a reputation for excellence in guiding individuals and teams toward improvement, combining professional expertise with a deep interest in personal development. Mr. Favor Caleb excels at helping others refine their speech while also contributing meaningfully to healthcare management. This unique blend of skills reflects a commitment to growth, leadership, and impact, driven by purpose and a desire to make a difference, and also continue to pursue opportunities that align with a vision of excellence and service. Thank you so much, Mr. Caleb Favor, for joining us today. Also joining us today is Miss Godwin Elizabeth, who is a girl child advocate and equality education enthusiast. She is deeply committed to advancing quality education and believes that every learner deserves access to meaningful, impactful learning experiences. Our work centers on strengthening education systems with a strong focus on supporting girls and young women to stay in school and thrive. She has contributed to initiatives that create pathways for school re-entering and has trained teachers in digital skills to improve how education is delivered in classrooms. With a growing background in technology, she brings a practical, forward thinking approach to education, one that embraces innovation as a tool for better learning outcomes. Our passion lies in shaping an education system that not only teaches but truly equips individuals with the knowledge and skills they need to succeed. Thank you so much, Miss Elizabeth, for joining us today.
Thank
So,
you. Thank you for having me.
all right. So before I take us into the questions, I want to set the scene because I think when people hear health in education, the mind immediately goes to a nurse's office in the corner of the compound, or a health lesson where children are taught the food groups. And those things are fine, but they are the surface of something much deeper. So let me point you a picture. Imagine a primary school in a low income community, 40 to 50 children in one classroom, a roof that leaks when it rains, no running water on the premises, two toilets at the back of the compound, shared between hundreds of children, rarely clean and sometimes completely broken. And then the children drink water from a commoner, like source that is not always safe. And by mid morning, some of them have not even eaten like since the night before. A child in the back row has poor eyesight, but nobody has noticed because there has never been an eye screening at that school. Three children have asthma, um, and then the dusty, poorly ventilated classroom makes it worse every single day. Now, how much learning is happening in that classroom? The teacher is trying, the children are trying, but the body comes first, always. A brain that is hungry, thirsty, hot, in pain or anxious cannot prioritize reading and arithmetic. So that is not, a character failure, and that is biology. And no amount of curriculum reform will fix it if the body is not okay. So now let me bring in the emotional dimension, because physical conditions are one part, but the mental and emotional environment of a school is just as powerful. Schools can be places of safety and belonging, where a child feels seen, valued, and free to grow. Or they can be places of fear, where bullying is ignored, where teachers use shame as discipline, where certain children feel invisible based on how they look, where they come from, or what they can afford. And so the science is very clear. A child's sense of psychological safety in school directly affects their ability to learn. Where a child feels safe, they're engaged. And when they feel threatened or unseen, they shut down, and you cannot teach a closed mind. And then there's something I want to name specifically because it does not get nearly enough space in this conversation. Like the menstrual health in schools, in many schools across Nigeria and across Africa, there are no private clean toilet facilities, no provision for girls who are menstruating, no no sanitary products, no privacy, no way for a teenage girl to manage her period with dignity during a school day. So what does she do? She stays home for 1 week, or like for 1 week every month, and that's up to months of school's days every year lost, not because of poverty alone, but because the school was never designed with a body in mind, and we call that a girl child education problem. So when actually it is a school infrastructure problem. And this is what health in education means: the leaking roof and the broken toilets, the hungry child and the burnt out teacher. The school stops showing up, and then the child whose chronic illness has been labeled laziness. So health is everywhere in the school environment, and where it fails, learning fails with it. So, and that is why we are having this conversation today. So, Mr. Caleb Favored and Miss Elizabeth, I'll be asking you some questions regarding this. But first of all, my general question goes like this: from where you each sit, one as a skilled diction instructor inside the classroom, every day, and one as someone who advocates for quality education. Like, what is the biggest health related challenge in Nigeria schools right now that the public is not fully aware of or taking seriously enough? Mr.
Good
Favor,
evening, everyone.
good evening, sir.
Can you hear me? I'm super excited to be a participant of this wonderful program. And my contribution is one of the most under-recognized challenges is the interception of poor sanitation. And learning outcome, while many people acknowledge issues like lack of infrastructure, they often underestimate how deeply unsafe water, inadequate toilets, and hygiene affect audience, concentration, and long-term health. From a teacher's perspective, children frequently fall ill due to these conditions, and learning becomes nearly impossible. As an advocate, the concern goes beyond illness. It's about system neglect of schools' health and policy, especially in public schools, where these conditions are normalized rather than treated as urgent problems. Thank you.
Thank you so much, Mr. Favor, for that wonderful contribution. Thank you so much. So, Miss Elizabeth, please, can you say something regarding that?
I have several things to say. When it comes to health-related challenge in Nigerian schools, and not highly talked about, we have mental, we have emotional. Just that Nigerians as a whole, don't see mental mental challenge or emotional challenge as something big. You cannot go to school now and tell your teacher that you're heartbroken, you cannot learn. He will say, who is this person? Are you okay? Something wrong with you. But there are actually some certain situations that child might have met at home that needs that child not to be emotionally ready to learn for that particular day. So we have emotional, we have mental, and we also have sanitation. There's also a health issues. We can attest to the fact that most public schools in Nigeria do not have good toilets. Most public schools in Nigeria do not have clean water, and we should take note that in schools, a bottle of water you take to school might not be able to sustain you for the several hours you are staying there. So kids will need to go get water, and then they're going to that source of water from that tank that has not been washed in 15 years, and that's where they are getting drinking water from. So you can see this health challenge of bad water when schools don't have good water, and then for the toilet, we God, I can say I'm traumatized by most of the experiences we had in school toilets in my days of secondary school because even though I don't even know if it's being cleaned every day, but there's no time you're going to the school toilet that it's clean. It is always messed up. It is always dirty. So we have health. I've talked spoken about the toilet. I've talking about the water. Another thing I want to quickly talk about is a condition, learning disabilities, ADHD, that is the attention deficit hyperactivity disorder that many students, many children in Nigeria are suffering, but nobody is talking about it. Teachers will flog a student, flog the hell out of a student for not being able to pronounce a word without knowing if that child have dyslexia or if that child have dyscalculia. I don't know how to pronounce all this medical term for a child that does not know, that has
Yes.
difficulty in reading and writing or has difficulty in numbers and mathematics. So there are people living with that condition, and most teachers in Nigeria are not sensitized that some people are born with ADHD, which means they have hyperactivity disorder. They can't read, they can't write. But if you give them creative art, they can do something in other space, but they cannot read. That thing you're teaching them on the board, it's taking them like 15, they need to say it like 15 times for them to grab it. And then there are some that once you say something, they've grabbed it, they've grabbed it, it's already stick to the head. So now the teacher treats that person that is smart and the person that has the ADHD the same. So if he asks a question in class and that particular person is answering, that one that is not with the ADHD syndrome, He feels the other person has been playing when I was teaching and then blocks that person, that other student, not knowing that this student is suffering from a disorder. So you see the challenges we are facing in Nigerian educational system, especially in schools that is related to health, but nobody's talking about it. Most teachers don't know that health disorder like ADHD, like dyslexia exists. Most of them don't even know that. Most teachers don't know that. So they just treat all students the same. If you learn, it's all right. If you cannot learn, you are punished. So let me just stop here. These are the health challenges in school that are faced in Nigeria, and it's not being spoken often. Thank you.
Thank you so much, Miss Elizabeth. And seriously, honestly, that is why we are having this conversation today. Because if we do not name it loudly, it stays invisible, and invisible problems do not get solved. So thank you so much, Miss Lizzie, for that wonderful contribution, and thank you so much, Mr. Favored, for that wonderful contribution. So my next question, Mr. Favor, goes to you. Like, I want us walk us through what a typical school day looks like when the health conditions are poor, no water, broken toilet. A classroom is not like a classroom is too hot or too crowded. Children coming in sick or hungry. Like, how does all of that actually change what you are able to do? You know, as um as a teacher.
Okay, it's like saying learning is not possible in such environment because no water means no basic hygiene. Because I don't fathom or imagine how a child after playing, jumping, won't have water to wash his or her hands. Like for example, the teenage girls and that just that just started their period,
A
they
period.
always need clean environments. And
Yes.
when there are broken toilets, it's very impossible for hygiene to be maintained in such school. And Freedom Ministry of Education gave us a certain number of. Now, if a class is congested, one, the class will be very hot,
Yes.
and
Exactly.
learners breathing in and out. Some of them are having communicable disease like cough, catarrh.
Yes.
You
Yes.
see, it's easily spread. I know how many times I do go to school as a teacher and I'll come back sick because of went there to contact. Because
Yes.
sometimes you see class is congested and when you talk, your voice is not making meaning. And for teachers, this means spreading more time managing when you're supposed to teach 35 minutes to cover up your lessons and for you to manage the environment that is noisy, not ventilated and discomforting. You will see yourself having to cover up the 35 minutes that is given to you. And sometimes it's teaching become less fun. Teaching normally is fun, but when such
Yes.
class is congested, there's no ventilation, students are sick, teaching will be stressful and frustrating. Like
Exactly.
when you are trying to comfort this one, when you're trying to help this one out, you see you'll be stressed out. And most
Yes.
Nigerian teachers today, once it is time to go to school, you will see them is like
Oh, I think Mr. Favor is having a network issue. Okay. All right. I think Okay. Okay, I think he's having a network issue, so we'll just wait for him to come back. All right, Miss Lizzie. Okay, your question. As a quality education advocate, what is the definition of quality education, and does health physical safety, clean water, working toilets, emotional well-being features in that definition? Or is it quality education? Is it still most measured by test scores and pass rates?
Okay, so I will first of all define what quality education is. Quality education to me is a learning experience that equips a child, that equips students fully, emphasis on the fully and not partially, to live a dignified, a productive, and a self-determined life. Now, we're equipping fully, meaning that health is a must. It means safety is a must. It means clean water is a must. It means functional sanitation is a must, and emotional well-being. So it is not just about schools. It is such a sad reality that most schools in Nigeria and the educational system in Nigeria focuses on student grades and not just the not the educational system. We all know parents, our parents focuses on grades too. You cannot tell a
Yes.
parent that you're the smartest in your class. Actually, you're the smartest, but your grades is not telling you the same thing. So they will say, as long as you're not taking first, you are a very lazy student. So we've centralized education, we've centralized the best of education to just be centered, to just be on grades, which should not be. Quality education means that child is getting every knowledge needed for the future, all the skills needed for the future, not just first, second position, not just average 90 something percent. Is the person getting the communication skills they need? Are they getting the skills they need for their future? As they're leaving the school, what is that skill they're going out with? What is the knowledge you're going out with? Not what is your grades that you graduate with, not is it first class. That's why you check most first class students don't even know anything about their course. They just carry first class and they just graduate first class and that's the end. Okay, you
Yes.
graduated with first class, come and you the first class in engineering, come and repair this, come and do this related to your course. You know nothing about it. All you know is that 1 plus 1 is 2 and 5 plus 10, and then you know about algorithm and all those things. But you just know the calculation, you just know how to get take first, but you don't know anything about the skill. So that is not
Yes.
what quality education is. If an education must be quality, it must tick everything. It must be fully equipped, it must be equitable, it must be safe, we must have trained teachers as well. So that is how you can now say that this education is quality. So quality education doesn't just have to do with passing WAEC. It doesn't have to do with passing exam. It doesn't have to do with taking first. Everything must be there. Safety that the child needs, the sanitation that the child needs, everything that the child needs to be put in place before we can say that an education is quality. Okay.
All right, thank you so much. Because what you just described is a much fuller, much more human definition of quality than what most examination boards or ministry reports use. And I think that gap between what quality really means and how we are measuring it is part of why so many children are passing exams and still not thriving. So we are measuring the wrong things, and we will still, keep getting the wrong results until we change what we count. So thank you so much, Mrs. Elizabeth, for that wonderful contribution. Okay, so my next question before Mr. Caleb join us. Um, every child has a right to quality education that is established in international law, in Nigeria's own constitution, and in the Sustainable Development Goals. But rights without enforcement are just words. So when schools have no water, no safe toilets, and overcrowded, classrooms, whose responsibility is it to fix that? And how do you hold them accountable as an advocate? Miss Lizzie, please. Please, can you answer that question? Okay. Okay, I'm going to repeat my question. I don't know if she's having a network issue. Like I said, every child has a right to quality education that is established in international law, in Nigeria's own constitution, and in the Sustainable Development Goals. But rights without enforcement are just words. So when schools have no water, no safe toilets, and over. Okay, welcome back, Mr. Favor. Thank you. Okay,
Thank you a lot.
all right. Okay, so welcome. All right, so Miss Liz, like I said, every child has a right to quality education that is established in international law, in Nigeria's own constitution, and in the Sustainable Development Goals. But rights without enforcement are just words. And when school have no water, no safe toilets, and overcrowded classroom, whose responsibility is it to fix that? And how do you hold them accountable as an advocate?
Okay. So one thing we need to know is once a policy is passed in the state level, it is now up to the government, or sorry, once policy is passed at the federal level, it is now up to the government of each state to implement it. The problem we have, especially in the educational sector, is if the Ministry of Education pass a policy in the federal level, the states fail to implement it. So the responsibility starts from the federal, then to the states, then to the local government. Everyone has a role. But once the state has passed, let's take for instance, the federal government passed a policy that each school must have 15 clean toilets. Now he has said it. It's just like God has spoken something, and then we are supposed to do what he said and we're doing it. So he has said that the Minister of Education has said this is what should be. Now the state government has to see that that policy is being implemented in his state. If he does not drive for it, who wants to drive for it? Then if he implements it in a state, now it is up to the local government to then make sure that each school in their government, each school in that local government is implementing that policy that has been passed down by the Minister of Education. So that is how it is. So under we have the Universal Basic Education Commission, the UBE, that's the commission and the body that is in charge of education in Nigeria. So once they give a policy through them, um, you bet exists precisely to force, to fund, to enforce basic standards. But the gap between the law says that it exists in the book does not mean it exists in the classroom. So it is the responsibility of the federal government. If it's the funds, they should provide the funds, give it to the local government. The local government will in turn to then give it to the state government. State government is the one to then give it to the local government, and then it passes down to the schools in each government. And also civic societies, communities, advocates, journalists, everyone has a role to play in this because if the state has said something and nobody is trying to drive it, that in my community we don't have this, so the government has said that each school should have 15 toilets, and in my own we don't have it, the government will not know that something like that is going on. So we need advocates from that community to speak up and say, this is it, and they can only speak up and drive for change if they have data. What do I mean? You can only go to court if you have evidence. You cannot go to court and go and start accusing, you do not have this. How did you know you don't have that? There's no evidence. Which is
Yeah.
why we need significant data on each community. How many community in this place are enforcing the rule given by the government? So even these advocates need this data to be able to push for it. That's why you can then say in in Abuja we have only 15 schools that are sticking to the policy, and then that is what they drive it. The government said all schools, but we have thousands of schools in Abuja and only 15 are sticking to the rule. So you see they have an evidence and a point to back up their claim. So for the government, for the advocates, and for the CSA, that is NGOs and other journalists that are speaking up, they need specific data. Like according to the UNICEF, that is the UN body, we have only 70% of Nigerian schools. That is roughly only 91,000 schools in Nigeria. That's roughly 91,000 schools in Nigeria that have no access to basic education services. Now these are what we are judging with. We have a solid data now that only 30% of schools have basic sanitation services. Now we have to understand that not all parents, not everybody have the capacity to move their child to a private school. We all know it is very expensive. But now these government schools are underlooked. You go to a government school, they are not toilets, go to a government school, they're having this, and and then it's as though only the individuals that have the private school are enforcing their own rules because it is their money. So they will enforce the rules into their own schools, and then public schools are so underfunded. We have 65% of primary schools in rural Nigeria that have no functional toilet. If there are 100 schools in Nigeria, 65% of schools have no functional toilet at all. So you can imagine how the students in those schools are faring. Okay. Now, 59% of schools lack basic drinking water. Are you saying that all these are large numbers? This is not a source poor country. The problem is isolation. The problem is nobody speaking up. The problem is everybody is just making do now. Na me go build them, na me go do am. So you see that it is everybody needs to take action. Both advocates, both community members, community heads, community leaders, parents, and even students themselves. So it's a political priority, we all know. It's a political problem, we all know. It's a money problem, we all know. But this we need to know that this money we're directing it to where children are, and these children are the leader of tomorrow. So if we want our tomorrow to be good, we want our tomorrow to be bright, we will spend that money on that on that education that we are saying the money is to. Thank you so much.
Thank you so much, Miss Lizzie. Okay, so what she said right now is that right and not self executing. Someone has to push. Someone has to ask the uncomfortable questions. Follow the money, name the gap, publics, and that is exactly what advocates do. And the fact that this conversation is happening, that we are naming these things on a platform where people can hear them, is part of that work too. So awareness is the beginning of accountability. All right. So, Mr. Caleb, okay, thank you so much once again for joining us. Okay. Question, Mr. Favor. Mental health in the classroom. Anxiety, stress, trauma, emotional struggles in children. Are teachers actually equipped to recognize these things and respond to them? And what happens when a child is clearly not okay emotionally, and there is no school counselor, counselor, no system, nobody to hand them to? Like, please, can you answer that question?
Yeah.
So, can you unmute yourself? Can you unmute yourself? We can hear you.
Can you hear me now?
Yes, I can hear you now. Thank you.
I said most teachers are not adequately trained to identify or respond to mental health challenges like anxiety, trauma, or emotional stress. In many schools, there are no counselor or structured support system. Everyone is just carrying out their day-to-day activities using their experiences as mother to follow the children, or using their experiences as father to follow their children, which is not really good. Teachers rely mostly on instinct rather than professional training. Emotional struggles are often misinterpreted to as discipline or laziness. When a child is clearly struggling, the teacher may try to offer comfort or adjust expectations. However, without proper support, the child needs to go on mates. From my standpoint, the highlight, I would like to say that mental health is still not integrated in school health framework, and learning become nearly impossible when a child is unstable, when a child is passing through trauma, anxiety, and so on, you notice that the teacher is struggling to fit in or to impact, and the stress and the workload will be too much. The mental stress will be too much on the teacher. And
Um, okay. I think his network over there is really bad. Are you there, Mr. Favor? Okay, so from what he said, he said that teachers are being asked to hold something enormous, and so the emotional lives of children, without the training, without the backup, without the time, and without the resource to do it properly, and they are doing it anyway. So because the children are there and need it, there's extraordinary, but that is extraordinary, and so it's also sustainable. And at some point, we have to stop expecting people to carry more than they were ever given tools to carry. Okay, Miss Lizzie, my next question, you know, there's a lot of conversation about girls' education in Nigeria, getting girls into school and keeping there. But how much of the girl child drop problem is actually a health problem in disguise? Bad sanitation, no menstrual health support, unsafe environment, and what are advocates doing specifically about the health barriers to girls' education?
Sorry, repeat the question. I didn't really hear you.
I
The
said
last
there's a
question.
lot. Okay, there's a lot of conversation about girls' education in Nigeria, like getting girls into school and keeping them there. But how much of the girl child dropout problem is actually a health problem in disguise? Bad sanitation, no menstrual health support, unsafe environments, and what are advocates doing specifically about the health barriers to girls, education?
Okay, thank you. So this particular issue is underreported deliberately. Do you know why I say that? Because if it is admitted that the one of the causes of girls dropout from school is related to health and school, then it's going to require investment. Sorry, give me a few minutes.
Okay. Okay, Mr. Caleb, are you okay? So, okay, I think they're both having a network issue. So, in case you have any questions, please drop on the comments section. If there's any question, anything at all you need to ask, please drop in the comments. Okay, are you there, Miss Lizzie?
Yes, 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 yes. Okay, so I was saying it is deliberately underreported. We don't really know the amount because if it is um, admitted that the cost of girls dropout is related to health issue, it's going to require lots of investment, and there are a lot of people that don't want to channel investment into that aspect. So it is underreported. But one thing we should also know is that when a girl has no private, no clean toilet at school, she faces humiliation and risks every day. Weeks of, okay, what if something happened now and I explain? Where am I supposed to go and clean myself up? There is no water. So instead of me to suffer all this thing, for that 1 week, I'm not going to school. And you don't know what that 1 week stopping to make her late. Okay, she now say, ah, for this 1 week I'm not in school. I've lost out. Okay, let's assume that the 1 week happened to fall in exam period or test period. Now she has to forfeit that exam because she doesn't want to risk going to school and humiliating herself, so she forfeits it. And then that will already cost her demotion or missing one thing. Have you understood? Now she would then be like, instead of missing, you don't know how this is how thoughts builds up little by little, little by little, little by little. And then that's how the thought of there's no need. I cannot go and repeat. She drops out of school. So this is how health issue can really insignificantly that we might think is insignificantly affect a girl's education and make her drop out. So she a few should we now speak about unsafe environment or the mental health that comes with emotional bullying? That is also a health issue. Exam might go to school and get bullied because of probably not developing fast, probably not beautiful enough, and then she's going to believe everybody. Everybody say, you know, fine, look at your classmates are fine, you are not fine, and then it is affecting her emotionally, and then going to school is like going into war. It's like going into dens of lions because she's going to be humiliated every day. Have you seen that she's going to drop school because she doesn't want to continue suffering humiliation? So these are ways that have actually been affecting girls' education, and it has not been pointed out or not been admitted that this is part of the reason why girls are dropping out of school. So, in response to this, what can advocates do? What can individuals do? What can teachers do? What can schools do? Create clean toilets. It does not have to be artistic. It does not have to be $1 million clean toilet. The one you have, maintain it, clean it, make sure it's always clean, make sure there's sufficient water running, make sure it is not messed up. And this also have to go through to the students, the teachers, the school owners need to educate it in. Let them stop messing up these toilets. Another thing advocates can do is to push for hygiene management, menstrual hygiene and management. You can go to school, teach girls about menstrual hygiene. What are ways they can keep themselves so that they don't get stained in class, so it does not disrupt their learning or make them not to go to school. These are
Exactly.
ways not only advocates, normal individuals can do this. You can write to school, go to school. Okay, I want to come and train girls on menstrual hygiene, and you do it and you're already helping, you're already trying to solve this issue that girls are suffering. Or is it distribution? There are many people that cannot afford pads. We all know that it is very expensive, and I don't even know why it has to be so expensive in Nigeria. Many of them can't afford it, and because what they are using is not sustainable enough, so they can't go to school. Advocates, individuals, whoever can give lending hands, can go to school, share sanitary equipment for them. It is something that we are opportunities to do. So it's not something that requires a lot. And then we also need to fight against bullying, emotional bullying, and any kind of bullying. So these are what advocates, so what individuals can do to resolve that particular issue.
Thank you so much, Miss Lizzie. Because I think, and this is something I feel very strongly about. You know, we have spent years asking why girls are not in school, and sometimes the answer has been right in front of us. You know, it is not always poverty. It is not always culture. Sometimes it is broken toilets. Sometimes it is the absence of a private space for a teenage girl, you know, to manage her body with dignity. And if we fix that, if we simply fix that, some of these girls come back, and that is not a complicated intervention. It is a decision. So thank you so much once again, Miss Lizzie, for that wonderful contribution. Mr. Favor Caleb, sorry, are you there?
An unstable network. Yes, I'm
Oh,
here, but I'm having an
sorry.
unstable.
Sorry about that. Okay, I have a question for you. Okay, if you could speak directly to school administrators, you know, government officials, or even the parents watching today, what is it that teachers have been wanting to say about health in schools that have not always had the platform or the safety to say? Please, can you answer that question? Are you there?
Yes.
Okay, thank you. Should I repeat the question? Can you hear me?
Yes, please. Yes, please.
Okay. I said, if you could speak directly to school administrators, government officials, or even the parents watching today, what is it that teachers have been wanting to say about health in schools but have not always had the platform or the safety to say?
Okay, as the voice of teachers, I'll go that way. If
Okay.
given the opportunity to speak out, most of them will say quality education is unhealthy in unhealthy environment is not possible. Health and learning are inseparable. Ignoring one undermines the other. So if you ignore health, learning is impossible. And some teachers would love to say we need support, not just expectation. Now, so many parents expect their children to go high academically, not minding the mental or well-being of the how the teacher is doing. Time being a school, as we've been talking about unsafe water, broken toilets, and all that. When the learners are having such challenges in school, it makes the teachers feel discomforting. So teachers would love to say that administrators, government officials should make this the work easy for them. Government officials to prioritize schools' health infrastructure like water, sanitation, and ventilated environments. Administrators to reduce unrealistic workload and provide mental health resources. And parents should understand that teachers are not miracle workers. So sometimes you see them sending their children to school, expecting them to come home like the teachers has played magic on them. It's not possible that way. The work is just like 50-50 from the parent and from the teacher. So parents
Teachers.
should note that teachers are not miracle workers. They are not. Thank you.
All right, thank you so much. Thank you so much. All right, so I want to sit in that for a moment because what Mr. Favort just shared is not a grievance, it is a diagnosis, and that echo, and a person who has spent years in the classroom telling us what the problem is and what is, and what is the fix looks like deserve to be listened to, and I hope someone who with decision making power who is watching this today, because the people closer to the problem almost always have the clearest view of the solution. So thank you so much once again, Mr. Favor Caleb, for that wonderful contribution. Okay, Miss Elizabeth. All right. So question: um, what does a school that truly delivers quality education, including a healthy environment, looks like in the Nigeria context? Not a perfect dream school, but something realistic, achievable, and already being done somewhere that other schools can learn from.
Okay, I'll dive into that question fast and answer as fast as I can. One, a manageable size classroom. The classroom does not need to be so beautiful, it does not need to be so aesthetic. If you can afford it, no problem. But you shouldn't squeeze students inside a small class. You know the capacity your classrooms can carry. If it is only 30, don't admit 50 students in that class.
Exactly.
They are
Because
learning a type in a little days, they are children sitting down and they are struggling to write sheet for me, sheet for me, sheet for me. It is affecting them. So you should have a conducive class environment. And also, We shouldn't just be collecting school fees, collecting money from students, and the roof over their head is leaking. There are some glitches, even if the student that broke it, they were playing, they broke the glass, they were playing their football and something sports. You shouldn't say because it's them, people are going to suffer for it, and you leave them like that at the hands of rain and sun and insects and whatever it is that want to creep into the classes. So a realistic healthy school has a manageable size classroom, has a qualified teacher. For education it to be quality education, it has to write qualified teachers. Because if teachers are not qualified, how do they manage the students? How do they give them quality education? So it has to have a realistic healthy school needs to have qualified teachers, teachers who are trained to assist students both mentally, assist them emotionally, and assist them academically. So it also needs to have functional toilets. It also needs to have clean water. If you can afford feeding program, feed them well. Me, I know the like learn if I dey hungry. So if you can afford it, it is not bad. It's hard to see that on Nigerian schools, but we can all tell that in schools abroad, they have breaks and the school feeds them. Because we all know we come to school, we are happy, we ate from home, 10 o'clock, we break. From 12, you just know that you're start shutting down small, small. The way you understand, the way you understand it again, till 3, some schools close for, secondary school, my school used to close by 4. So some schools, before that 4, you're already blank because your mind is just my belly, my belly. And if it's a boarding school, let your accommodation be conducive. Some boarding schools, even the owners of those schools cannot send their kids there because of how unconducive it is. She talk about how dirty it is. The food they are eating in that boarding school, as though they are begging for it. These are people that are paying school fees. So it needs to be conducive. Let it be somewhere that is beatable, that is inhabitable. So that is what it looks like. And there are already schools doing that. There are already schools that are actually having this a realistic, healthy environment. And also, we need to have an accountable head teacher because for change to happen in a particular place, in a particular organization, the head person there needs to actually be for the change. Else, it's going to be as though this just be back and forth. So we have for the organizations doing that in Lagos State, we have the Eco Excel program, and this program has been transforming Lagos State primary schools with measurable improvement in learning outcomes and data-driven methodology. So we also have in Edo State the Edo Best program. We have in Ekiti State. These are states that put in programs that are helping schools. This can also be done by advocates. This can also be done by need NGO. We have projects that you can carry out to increase the quality of education, to increase the health in education, to increase the health in schools as well. So that's the little I can say for now.
Oh, thank you so much. So I want everyone to hear what Miss Elizabeth just described, because that is not a fantasy. No, that is a school that exists. All can exist with the right priorities and the right will. And what it tells us is that the gap between what our children have and what they deserve is not as wide as it sometimes feel. So it is a gap that can be closed, and it requires its consistent pressure, consistent advocacy, and communities that refuse to accept less than their children deserve. So that is what quality education advocacy is. Refusing to accept less. Okay, before we go into our close, we have two questions that came in ahead of today's section, and I want to put to our guests. Um, the first question: my child complains of headaches and stomach aches almost every school day, but the doctor says there is nothing physically wrong. Could the school environment itself be making my child sick, and what should I do? Um, so, Miss Elizabeth, Mr. Favor, Caleb, please can you answer this question? I'm going to repeat it again. My child complains of headaches and stomach aches almost every school day, but the doctor says there is nothing physically wrong. Could the school environment itself be making my child sick, and what should I do? Okay, please answer the question. Okay, Mr. Favor, please.
Okay.
All right.
So sometimes administrators should be conscious of the people they allow in the school to sell things. You understand? Sometimes you
Yeah.
just see people bring in different type of things, all in the name of snacks, and they will persuade the children. And once a child gets it and get to the class, oh, what is this? This is this. They'll just tag it a name and make this thing look colorful. Before you know, this will get, and at the end of the day, it will end up with stomach ache. And sometimes the workload the workload on children are too much. You see teachers, some of them are just being lazy. Some teachers naturally are lazy. You see them once they are they've not been able to cover up their screen, and CA is about approaching. You will see them bombarding the children with work.
Test and
And
assignments.
sometimes the child will, you there are some children that are outspoken, and you hear them, mom, sir, I'm tired. Come on, keep quiet, what are you talking? Because they don't want the HM or the administrator to come vet their work, and they've not done anything, and they don't want query, you know. And sometimes I don't know the time frame some schools you see after 3 o'clock lessons, you go into extra lessons. I guess that's too much for children. I guess that's too much. Thank you.
Okay, thank you so much for that wonderful contribution. All right, Miss Elizabeth, do you have anything to say regarding that question?
Uh, he has said everything. He has said everything. And I would
Okay.
like to add, for extramural classes, I understand most of the extramural classes are held for students that want to write WAEC or have national examination or something. But we that went through it knew it was not easy for us. Like being in class, learning the whole day, and then from three you are still like you're still having hungry stomach. You're hungry, oh. But because you must attend extramural classes, once it's three, you still join classes again. And for that parent that asked the question, you can't just um, say the child is having an issue from school. So you need to go and test your child. If the child is complaining consistently whenever the child comes from school, it might be what you give that child to eat. It might be the lunch you give the child. It might also be what the child ate from school. So you can't know until you tested. And as he has said before, not everything should be allowed into school premises for students to eat. I feel each school should have a canteen, and only what is approved should be sold in that canteen. So, and other these hawkers and just anyone shouldn't be let into the school premises to sell things to students. You don't know where that person is coming from. You don't know what that person is selling. You don't know that person maybe you just bring it to the school. So I feel like each school should have like a gate that if you are not will I say permitted, yes, let's use the word permitted to go in to sell. And before a school should permit any seller to sell something, they should have investigated that seller first to know the quality of what that seller is. But most schools don't have the time to do all this, so they just buy. But they should have
Yeah.
investigated that seller, found out even down to where that seller is making that thing the person is selling, because you don't know what the person, the condition of the house or the condition of the shop that thing you're eating is
Exactly.
coming from.
Exactly.
Because
Yeah.
these are
Yes.
kids. The enzymes we have that fight diseases might not be the same as strong as theirs. So these things need to be put in place.
Thank you so much. And I believe every parent watching this today can hear this. You know, as a parent,
How
always investigate your child, your child, the school environment. Ask your child what school feels like, and not just what they are learning. So thank you so much for that wonderful contribution. All right. Okay, the next question.
I think Mr.
Okay,
Favor
someone
wants to say something.
huh? Okay, Mr. Favor,
I
do
think
you want to
Caleb,
say anything?
to advise? Yes, I said I would love to advise the parent to go lay the complaint to the administrator. Like, this
Okay.
is what is going on. You need to monitor what's going on in your school. If it
Yeah.
continues, I guess the parent should be forced to pull out his or child there, because I wonder why you be spending money on health and spending money in education while your child is going, instead of your child to go there and learn and come back
Yeah.
healthy. Your child will go there, learn and come back sick. It is
Yes.
better, it is better your child goes there, come back healthy than going there after learning, come back sick. So if it continues and you've laid the complaint to the administrator or the owner of school and it's repeats, I guess the parents should be forced to withdraw the child from that school. Thank you.
Exactly. Thank you so much. Okay, the next question. All right. Um, as a teacher, I genuinely care about my students' health and well-being, but I feel completely powerless. The school administration does not listen. There is no budget, and I am already overwhelmed. What can a teacher actually do when the system is not supporting them or their students? So, okay, Mr. Favor, please, you can answer the question. Can I repeat it?
Um, yes,
Okay,
please.
okay. As a teacher, I genuinely care about my students' health and well being, but I feel completely powerless. The school administration does not listen, there is no budget, and I am already overwhelmed. What can a teacher actually do when the system is not supporting them or their students?
Now, you are at the middle. You can't get support. You shouldn't expect support from the your students. You should be expecting support from the administrator. If the administrator is not supporting you, that means one day or sooner you get frustrated. And when you get frustrated, you then bounce on the student. And when you bounce on the student and injure them by mistake, then the parents will come back to you. And when the parents come back to complain, then the administrator will bounce on you. so so I'll just advise you just have to, if you're passionate concerning your work as a teacher, just step down, look for a better offer, look for a better place. And once you get a better place, give a notice of about, let's say, a month, and you step down. That's all. Remaining there, one day you get frustrated because you're not getting support and bounce on your learners. And when you bounce on them, as a mother, you will not love your children to come back and you're seeing bruises or them spanks, fingers on their face. You want to go back, like even the administrator would deny you that he didn't do this, he didn't do that,
Thank
not
you.
knowing that
Yeah.
it's coming from them. So I guess you should look for a better place. Once you get, drop a notice with the school and resign. Thank you.
Thank you so much. Okay, Miss
Just to add
Elizabeth.
a little, yeah, as even as you're resigning, you should note that the condition is actually affecting the students, and you won't want to leave those children in that particular toxic environment. Now, you can calmly, first of all, speak with the administrator. If they are still proving stubborn, for the sake of those students that are there, and for their, because you as a teacher, you have the condition of your students in your heart. You should care for them. You can write to the VEB, you can write to the main authorities in education that there is this school that is not meeting to this, and this is it. So, but first of all, before you write, leave there first. Let them not come pay you. But you can write, and then
Yeah.
the authorities can then go investigate that school just for the sake of those students that are there.
Okay. All right. So thank you
Please,
so much.
I want to, Miss Lizzie, do you know that if you're being passionate concerning your teaching, you should also be mindful of your mental health. Now,
Exactly.
when you're saying you care about your learners, you care about the children, you don't want to leave and so on. When trouble arises or when situation that you can't handle arise, you see the parents, they'll be forced to withdraw that child that you cannot leave because you're trying to be will I say a good Samaritan. You understand? So I will
Yeah.
advise, if it continues, you just have to step down so you won't put yourself in trouble. You understand? Because sometimes with the condition of Nigeria, you don't need to be stressed at all. You don't need anything that will stress you. So you not get frustrated and do something that you regret at last. Thank you.
All
I
right, thank you.
understand, but what about the students? Sorry, but what about the students? So, advocates are good Samaritans. They are, you're thinking of your mental health, but you also know that this particular situation is affecting someone. It's affecting somebody. Even if both parents pull out their child, the next child coming there is also going to be affected by that administrator, that administration. So, in another words, you're thinking about your mental health, you can do it anonymously. You can write
Mm-hmm.
anonymously, nobody will know it's
Yeah,
you. So,
yeah, I understand. Yes, that's true. That's true.
All right. Okay, thank you so much. So we are coming to the end of our program. But before I let go, I want to give each of our guests one final moment to speak directly to whoever needs to hear this most today. Maybe it is a parent, maybe it is a teacher, maybe it is a school administrator, maybe it is a government official who wandered into our comments. Whoever you are, what do you want them to leave with? So, do you have any contribution to say? Anything? Do you have anything you want to say before we get to close? Is there anything you want to add, to say? Any contribution?
okay, so I'll go first. I
Okay.
want to speak to everybody, both parents, both teachers, both people, whoever it is watching, and whoever it is that will watch. We all have a role to play if we want to change the way educational system is in Nigeria. We don't always have to wait for government. We don't always have to wait for the educational authorities, for NGOs. We in our own little way can do something. Now, we need to understand that if kids do not have books to learn, it is affecting them. If they do not have footwear to wear to school, it is affecting them. If they do not have school bags to wear to school, it is affecting them. We are learned. We also know that there's some policies that have been stated by the government regarding education. You've seen it, we've heard of it, we've seen it online. But you know there is a school close to you that is not implementing it. We should also act. For the books, most of us have books we used in our secondary school age that have just been there as though we're storing it to use it as something in the future. We all know we're not going to use it. That book that is wasting in your room can be an upliftment of joy for a student that is being depressed because they don't have textbook and they cannot use. That school bag they are not using can help a child that doesn't have school bag. You that has the zeal to teach, you always want to say something, you always want people to learn. What are you using that skill for? Do you know you can just gather people, kids in your community, and okay, we're holding a book club, we're holding a lesson, even though it's just for one day. What did you learn today? Let's talk about it. Did you know about this? Do you know about this? Do you know you're helping those students? You're helping a student that has ADHD, that has problem learning. When that child has gone to school, the teacher has spoken, does not understand. If it comes from repetition of that same thing, will make that child understand. At least you are helping providing solutions. So we should not always wait for schools, we should not always wait for authorities. We don't have to wait for government to come and start distributing pads to young girls in school. We can do it. Let us do it. We all have a role to play. If you do not know what to do, you want to have quality education, reach out to us. Reach out to advocates out there. Reach out to people doing something that will direct you on what to do. All of us can change Nigeria one activity at a time, one person at a time, one school at a time. Thank you.
Thank you so much, Miss Elizabeth. Thank you. Mr. Favor, Caleb, do you have anything to say? Any
Okay.
contribution?
I first of all love to appreciate everyone watching. So for
Thank
those
you.
that are watching and those that will watch later, my advice to administrators, proprietors, proprietresses, head of school, and so on. Now, a school is a building where learning takes place. As a diction instructor, I just have to come down to um the level where everyone can hear me. If I'm to speak, you can barely hear. So I just have to come down. Now I work in about 5 to 6 schools. Now I know the best because of what is happening. School is just a building, but what is happening in the school is what matters. Now, if you are a head of school or a proprietor or proprietress, and you're not seeking a greater height every term, your school remains the same. No, it's not good at all. It's not
Exactly.
good. As a yeah, if you're to come to me or if you're to come to me to seek advice to recommend a school for you, I have about 2 schools that I can recommend to you because of how strict and good and consistent they are with their work. There are schools I cannot even mention, but I work there because of how nonchalant and they're not really doing well. I've talked and talked, they're not still doing well. So, as an administrator, ensure that your teachers are carrying out their duties and give also make have a cordial relationship with your parents so that they can pass any information to you. Give them the opportunity to go around the school environment and check things for themselves. Thank you very much.
Thank you so much, Mr. Favor Caleb, for the wonderful contribution. Thank you both genuinely. Thank you. You know, you're giving this audience something real today, not just information, but a new way of seeing something that walk past every single day without fully understanding. You know, health and education are not just two separate conversations. They are one, and every broken toilet, every hungry child, every burnt out teacher, every girl who stays home during a period. Every one of those things is a choice that our society is making, consciously or not, and it has a cost that shows up in our children's futures. So here's what I also know: every child that fixes its toilets, every teacher whose well-being is taken seriously, every girl who stays in school because her environment finally respected her body. These are also choices, and they are choices that any community, any school, any parent, any advocate can begin to push for today. So you're not powerless. Ask the questions, speak up, advocate, pay attention to school near you, because all these schools are not a government promise we are waiting for. They're community demand we have to make. So thank you, Mr. Favor Caleb and Miss Elizabeth Godwin, for showing up, for being honest, and for caring enough to be here. And thank you to everyone who watched, commented, shared, and sent in questions. You are what makes this community worth building every single Thursday. Please like this video if today gave you something. Leave a comment. Tell me the one thing that hits you hardest from this conversation. Subscribe so you never miss a Thursday, and share this. Send it to a parent, a teacher, a school board member, a friend, because somewhere out there is a person who needs to hear what we talked about today, and your share could be the reason they do. I'll see you next Thursday. Take care of yourself and take care of the children around you. Thank you. Bye.